Okay, I guess I'm live again. So we're going to try this again. And hopefully the volume's in this time, but who knows? So, okay, I wanted to talk just a little bit about what's going on with the BA.5 because, it's just been blowing up all over the place. And for me in clinic, what I've been seeing is this has spread faster than any other variant that I've seen. So, super fast. And what we're seeing, I'm going to stay really local because when you try to look at this as the United States or even global, it just gets so big and it gets just so it's too complicated. The data, the problem right now with trying to figure out what's going on is the virus, it's mutating too quickly. So, everybody, it's like quicksand under our feet. It's just moving so fast that, you can't really make valid decisions. And you go out there to try and find answers, and it's just all over the place. So, let me tell you what's happening right now. And we're going to stay in the Pacific Northwest, and um, we're going to talk in the Pacific Northwest, and I wanted to start with the hospitals because let me see here if I can get to that. Whoops, let's see here. Okay, there we go. Okay, so what we're seeing, hospitals here in the state, a lot of them are over 100% capacity, especially on the west side, which is, over here by Olympia, by the ocean, everything. It's over 100% capacity. And you know why they're saying that? It's not all COVID. Now, granted, the COVID infections have been increasing and the COVID hospitalizations have been increasing. So let's see here. So, hospitalizations here, the COVID hospitalizations have been ticking up quite a bit. So, about 10% now. Now, during Omicron, it got up to about 29 people per 100,000 in population. Now, under Omicron, the hospitalizations were about 27 people per 100,000, and that was filling up our hospitals. So, now that it's just 9, 10 people per 100,000, that's not the only reason why our hospitals are full. So, according to this, what they're saying is it's a mix of things. There's a lack of staff, there's a lack of available beds, and then trying to transition patients into long term facilities. So, I guess you need a legal guardian to sign off before moving a patient to out of a hospital. Who would know that that would be a problem? But if there's no family member available, then you have to get a court appointed guardian. That's so bizarre that that's a problem here, but I guess it is. So right now we're seeing a problem with our hospitals. They're overcapacity in Washington. It's not all about COVID. The rate of hospitalizations for COVID are about a third of what they were during Omicron. So, okay, that seems like good news, right? And what they also, if we looked at data out of Portugal, Portugal was saying that what they were seeing is the number of deaths were similar to the flu season. So the flu season for us is about 52,000 people. So if this variant is going to be similar to that, then maybe the total deaths will be about 52,000 people. Now, the big difference between this BA.5 variant and the flu is the flu lasts for 7 months. This variant lasts about a month. And so that is what is going on with the statistics here in the state of Washington. Now, one of the things that's really confusing is, what should you do to protect yourself? Because you're like, well, I got the vaccine, so I'm protected, or I got infected just last month, so I'm protected. Guess what? Nope, that's not going to help you right now. So if we look at this is, they call it reduced neutralization. of SARS-CoV-2. So the ability of your vaccine to neutralize, which is basically ward off COVID-2, has reduced significantly. And what they're seeing is 6 months with this one's Pfizer. 6 months with Pfizer, a 12% reduction. And here's the other weird one. At a half month, there was a 37% reduction. And I didn't look to see, these must be cumulative. So it starts out with 37% reduction, 3 months, 24% reduction, and then 11. The Moderna one here, 2 Moderna and 1 Pfizer, what they saw was minus 20, minus 23. This one is the Johnson & Johnson vaccine, and they also got a Pfizer. And that one saw a reduction also. And then there was another one that they did on the monoclonal antibodies. Now, that's one of the treatments that they have for SARS, where they give you, I believe this is an IV, and here it is. The monoclonal antibodies failed to neutralize. This is Omicron. So the monoclonal antibodies they said it didn't work on Omicron. Now, what that is a monoclonal antibody is actually a white blood cell. And a white blood cell is specific, right? It's specific to a specific virus, bacteria, or whatever, but it's very specific. So if that changes, that white blood cell's not going to work anymore. And that's what's happening with these monoclonal antibodies is the COVID is changing so much that, these targeted treatments aren't working because the target just moved. What about if you got a natural infection? And this is the natural infection, and they're seeing that your immunity against COVID over time is reducing. So if you got the natural alpha, that was the 2020, that one, well, then, you were 90% protected against another alpha infection. You were 85% against another delta. I guess this is 90 or 85% against beta. Then delta, you were 92. But Omicron, you're like 56% protected. So even your natural immunity was reducing before we got to this BA.5 variant. So the bummers there is that what we thought we had as an immune system, it's not there. And then we have these treatments like the monoclonal antibodies. It doesn't seem to be there for that either. Now, you see that Dr. Fauci and President Biden are taking that Pavlox. I don't know how to pronounce it, but it's an antiviral treatment. So what's different about an antiviral treatment? Well, the difference in an antiviral is instead of, let me turn this off here. Okay. So the difference in an antiviral versus the monoclonal, that's a white blood cell. So it's a white blood cell. So it's like your immune system. An antiviral is something that we inject into the person to attack the virus. So it's not a part of our immune system. It's something that is supposed to reduce the effectiveness of the virus. And this Pavlox, whatever it is, what it does is it slows down this protease that the virus has. Wow, that was just like a lot of nonsense there. Who understands that? But you know what you do understand? Enzymes. You know how we have to take sometimes, like some of us, we don't have the best digestion, and our naturopath or our Chinese medical provider or our chiropractor, they go, hey, why don't you take enzymes? And you go, yeah, okay, I can do that. And those enzymes help break down that food, help break down the proteins, the fats, and the carbs that you are eating. Well, and if it's an enzyme to break down fats, it's a lipase. If it's an enzyme to break down proteins, it's a protease. Well, what's interesting about COVID is it brings its own enzymes with it. It brings its own suitcase of stuff to effectively infect your body. So it's bringing its own protease with it, and it needs that enzyme because it wants to break down some of your proteins. And when it breaks down your proteins, it's like, yeah, thank you. I had to break that down so I had food to create viruses in your body. So it brings its own enzyme and it goes and breaks down your protein to feed itself so that it can feed on you. Wow, isn't that nice of it? But this antiviral treatment, what it's supposed to do is it's supposed to get in the way of that enzyme, slow that enzyme down so it can't break down your proteins. And if it can't break down your proteins, it doesn't have anything to eat. And if it doesn't have anything to eat, it's going to starve and not recreate in your body. At least that's what the thought was, right? So it seems to work sometimes, but what they're finding is that there's rebound on it. And I didn't look into the research on this in depth to figure out if it's just for this BA.5 variant or if we're seeing rebound across the board. But let me go back to this. Not that one, not that one. Professional, not that one, not that one. Boy, I don't know if I'm going to find it here. It's the monoclonal. Sorry, this is taking me so long, guys. Let's see if that's it. There it is. So exciting. So this is the CDC. The CDC actually said, hey, we're starting to see that there's rebound after this treatment. And that's what happened to Dr. Fauci. I hear he's on his second round of this Paxlovid, I think that's how you pronounce it. So, and he's saying that his symptoms are pretty bad. So, okay, so that's Paxlovid. Okay, so let me talk to you about what I am seeing in clinic. So I'm seeing the range across the board. But I'm seeing a lot. So this came in faster than any of the other variants that we've been exposed to. The only other variant that came in faster was the first variant. Remember the one that hit us by surprise? None of us knew about it. Everybody was walking around with this horrible flu and we were just rapidly infecting everybody. That's the only other one that I've seen transmitting as fast as this one. It's just, I think the time frame is a little bit shorter. Like the first one, it was December, January, February, and March that it was really spreading and gaining ground. And it was by February when it was really big. This hit landfall like a couple weeks ago, and I'm seeing pretty consistently like 30% of my clients are infected every week. So, wow, huh? It's a lot. And the range of infection is all over the board. So it's from that, I think I have allergies. And you hear it. Everybody's going, oh no, this is not COVID. This is allergies. I have allergies. And you know what? I hate to tell you guys this, but I'm hearing this from people who've never had allergies, and suddenly they're like, no, this is allergies. Well, let me tell you. Let's look at this. This is today's allergy map. So this is Washington. We are in the medium zone and the low zone. So we are in the medium and low zone. Do you know historically when people would say, yeah, that's my allergies, that we would be 8 to 12. So right now we are like 2.5 to 6. I've never seen people running around saying this is my allergies and their nose is running and they're all congested and they're sneezing and they're coughing. The only time I've seen that is when we've been at an 8 or higher. So just saying, we're not there. We're not that high on our allergy map. So maybe this is COVID that you have, because what's one of the key symptoms? Runny nose, sneezing, congestion. So those are the key symptoms. And and then you might say, well, you know what? I did a COVID test. I did a COVID test multiple times. And let me see here if I can find this. Reduce neutralization, a review, monoclonals. Nope, 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 nope. Oh, here we go. Finally. Okay. How accurate? Oh, so here's the skinny on accuracy. So the home test and the rapid antigen test at the hospitals are the same things. The PCR test is the one that's different. But so they're the same things. And, how accurate are they? Well, what they found in March 2021 is that if you have symptoms, they can be 63 to 79% effective. So maybe there's 72% effective. What they're finding without symptoms, if you're asymptomatic, bigger range, 40 to 74% effective, maybe 58% effective overall. Now, if you do it during the first week of symptoms, 78% effective. So that's really interesting. They really want you to get it during the first week, because that's when you have the most immune response going on. But here's the thing. There's a huge range of accuracy between these tests. So Chorus Bioconcept, only 34% effective, versus standard, which was 88% effective. Now, if you get a negative, I can tell you all the negatives are correctly classified, but positives can be incorrectly identified as a negative. And for this one, it's about 50% of the time, it's incorrectly identified as a negative. Abbott, about 45% of the time. Medsan is about 46% of the time. Siemens is about 55% of the time. So the thing is, the tough part about this is timing's important on when you get your test, and then also its ability to be accurate. So it's most accurate if you actually took it the first week of your test of being sick, but then after that, it starts to reduce its accuracy. And then just overall, its accuracy can be pretty low. So, you might be testing negative, and you might be testing negative over and over and over again. But if you have symptoms and you're thinking it's allergies, well, let me tell you, the allergy season, it's not bad right now. It's actually really good. Usually we don't have any issues when we're in the low to medium range. So maybe it is COVID. And then if you have symptoms, it could be COVID, could be sinuses, could be anything else, but other people in your house are testing positive when you're testing negative, then you probably are getting a false negative and you're actually positive. So, there's a lot of things going on with the tests. They're like super not accurate. And so I would really reconsider thinking that it's your allergies. But, just, you got to be you. So, okay, let's talk about the one thing that we don't really understand at all, and that is the long haulers. And This is really interesting. Where is my they just released a study from the VA. So, the VA has this huge database that has a lot of access to really good information. And we'll start here. So, they did this study. The VA COVID-19 long haulers. Oh, well, the title of this is really bad, but what it was VA data shows that patients who had recovered from COVID are at risk. Okay. And really, what I wanted to do was talk about the study and not the horror headlines, right? Gosh, like we need that. Okay, so what they did, here it is. They compared 6 months of outcomes of more than 73,000 VA patients, and they compared it. Now, these patients had COVID, so they were wondering, okay, what happens here? And they compared it against 5 million VA patients who had not contracted COVID yet. That was back in 2021. And what they found was 8 to 10% of the population was getting COVID. Now, that's last year, right? And I'm hearing that that number has increased. And long COVID, there's like 300 different symptoms you can get with that. They're learning a lot more about this. So, one of the reasons why there's so many symptoms that you can get is that it suppresses your immune system so much that all these other bacteria and viruses that are in your body start getting more free reign, is one of their thoughts. But what I noticed in this issue, two things. The study showed that multiple COVID infections increase likelihood of long haul health issues. So the more times you're getting infected, the more opportunity you have to get long haulers. And this Dr. Bennett said something pretty interesting, trying to just kind of explain it to me. He said, okay, look at it this way. The more times we get exposed to secondhand smoke, the greater risk we get to developing lung cancer. So he says, in this case, the more times we are exposed to COVID, the greater chance we get diagnosed with long haul COVID. Ouch, huh? So this isn't like the flu. This isn't like, oh, you can get infected and everything's going to be fine afterwards. They're saying the more times you get infected, the bigger your risk. And back in 2021, 8 to 10% of the people who were getting infected had long haul effects. What I'm seeing now is this number's increasing. So there's one more part of this study that I wanted to talk about. And that is one of the long haul symptoms. And that is the long haul symptoms on the brain. Okay. So there is becoming more and more reports out there on COVID-19's impact on the brain. And this report said in their study, they said it's the immune response that we think is damaging the brain, and we're hoping that we can use that information to find a cure. But you're hearing people talk about all these brain symptoms, right? And from brain fog to anxiety to nervousness to fear to PTSD to inability to think or to process, or just all these really weird neurological symptoms happening in the brain. Okay, why did I bring that up? Well, this is why I brought it up. There's another study going on. This study is going on at the University of Bristol. Amazing, huh? So they just got the study approved. They're just getting their candidates into this study. Guess what they're studying? They're studying babies. So babies that are newborn or recently birthed, what they want to do is this here. Okay. So we know that exposure to certain viral infections shortly after birth or during pregnancy can impact a baby's brain development or affect their development later in life. So we don't know if SARS-CoV-2 does that, but we are seeing that it's impacting the brain in people who have had COVID. So what they want to do is they want to do a study on children who were exposed to the virus during pregnancy or shortly after birth. And they want to compare that to infants who haven't been exposed to the virus. And they want to see if that impacts their development over the next couple years. So the recruitment is going on through October 2022. So isn't that amazing that they think that it's that big an issue that, yeah, probably should study it. Okay, so let's see here. Okay, so they think it's that big an issue that they're willing to study it and to fund that kind of research. So I guess what I'm saying is that it appears that long haulers is going to be a bigger problem than we thought it was. And it appears that every time we get infected, that our potential to get long haulers increases. And it appears that they're so sure that there's a problem with this impacting and damaging our brain that they're willing to research newborns because they really think it does have an impact on them. Wow, huh? Okay, well, so, I think that this whole COVID thing, it's so incredibly stressful. It's so incredibly grueling, and it just goes on forever and ever and ever. Yet there might be more information that's coming out now that might have you rethinking some of the things or some of your actions or some of the things that you're doing. So let's talk about what can you do if natural immunity isn't working, if the vaccines aren't working. Well, what can you do? Well, I can tell you social distancing might be an option. And I can tell you here that is not people's favorite thing to do. So you can see here, we're out at the beach. Nobody has a mask on out there. Social distancing is not even a suggestion. And that's okay unless you get sick and you go to the hospital. So, and it's okay if your kids are not getting hurt by this virus. So, and I don't want to take everybody's fun away, but I do want to say that, maybe there's something to be said about some sort of social distancing, although they think this BA.5 is so transmissible that they don't really care. They're like, yeah, you're outside, wear a mask. And the other thing is you might want to think about wearing a mask because, again, this one's spreading so much faster than any of the other ones have. And yeah, it is more transmissible, but the only time I've seen things spread this fast is with the alpha wave when we weren't masking. I can tell you with the beta, delta, Omicron, yeah, it spread, but it wasn't like this insane, rapid taking over the town kind of thing that I'm seeing right now. And the ones on my clients, the ones that have gotten really sick, that have ended up with pneumonia, they've gotten infected like 4 times. And, I know a couple who have gotten infected 3 times. And here's the other thing. You can get infected right away. I had somebody get infected with that BA.2, and a month later, at the beginning of this BA.5, they were infected with that BA.5. It was literally a period of 4 weeks, and they were reinfected. So, oh my gosh, it just keeps on going. It's just the gift that just keeps on giving. So think it through. I think mask, being kind of smart about your social distancing, crowds, maybe trying to rethink how you're going to be around crowds because we know COVID loves a crowd. So you guys be safe. And until next time, I'll catch you on the other side.